As in the previous lecture, we discussed the perimetry, okay? We discussed the kinetic and static perimetries, okay? And how can we evaluate the visual fields, okay? For the detection of any visual field defects. So, now in few words, what is the advantages of the static perimetry over the kinetic perimetry? As the kinetic perimetry is a manual process, okay? It is a manual procedure in which we check the visual field points manually. But the static perimetry use a machine, okay? So that's why static perimetry is an automated procedure and which has many advantages over the kinetic process, okay? Now static perimetry gave us three-dimensional evaluation of the visual fields, okay? And it can check centrally as well as peripheral field of vision simultaneously, okay? And as we are using the machine, so the points can be rechecked again and again. We can check the visual field points as many times as we want, okay? So the points can be rechecked and the results can be reproducible. As through the machine we can generate the results again and again, okay? And the last advantage of the static or automated perimetry is that software can be used for the analysis of these visual fields, okay? So these are some of the advantages of the static or automated perimetry over the kinetic perimetry. Now, through these perimetries, we can have a lot of visual field defects in glaucoma. And these visual field defects, in the context of the perimetry, these visual field defect is called scotoma, okay? A visual field defect is called scotoma. The visual field defect can be a complete blind spot, okay? We can have a complete blind region in the retina. This complete blind region is called absolute scotoma, okay? So we can have absolute scotoma. And if there is only the reduction of sensitivity, okay, there is no complete blind spot, but the sensitivity has been reduced. This is called relative scotoma, okay? Relative scotoma. So we can have a complete blind spot or a partial blind spot, okay? A reduced sensitivity. Now, we can have a lot of visual field defects called scotomas in the glaucoma, okay? So these can be early visual field defects or moderate visual field defects and advanced visual field defects. So early in the glaucoma, there are some of the several types of visual field defects, okay, which can be found earlier in the glaucoma. These visual field defects, the first one is the generalized depression, okay. There can be the generalized depression. Means that in the entire retina, there will be the diffuse dropout of the ganglions, okay. There will be the diffuse dropout of the ganglion and the visual acuity will be reduced, okay. So there is no complete blind spot, but in the entire retina we have reduced visual acuity because of the diffuse dropout of the ganglions all over the retina. This is called generalized depression, okay. So we can have generalized depression, okay. We can have generalized depression. Now, in the early visual field defects, we can have paracentral scotoma. Scotoma, the visual field defect near to the center, okay. So we can have a visual field defects near to the center. This is called paracentral scotoma. So we can have paracentral scotoma, okay. In the early field defects, we can have a visual field defect, a line. This is called Raynaud's nasal strip, okay. So Raynaud's nasal strip, as it is in the form of a strip, okay. This visual field defect, as we know that the light rays, they are converging like this, so okay. From the retinal side, the light will come like this and it will converge on this temporal side. As we know that the light from the temporal side, they are converging on the nasal side of the retina, and the light from the nasal region they are converging on the temporal side of the retina. So this nasal strip, as we know that light is coming from the nasal side, okay. So that's why this defect is on the nasal side in a stiff form. This is called Raynaud's nasal strip. And the important point in the Raynaud's nasal strip is that this defect, it is respecting this horizontal line, means this strip does not come, okay, this strip does not come anywhere below or above from this strip. So that's why this defect is in the strip form and in a horizontal pattern, and which follows this horizontal pattern. Do not go above or below, okay. This is called Raynaud's nasal strip. Now, in the early visual field defects, we can have scotoma, which is called bearing of the blind spot. Bearing of the blind spot means that as we have bearing of the blind spot, bearing of blind spot, it means that as we know that this is a blind spot which is the optic disc itself, okay. It is a natural blind spot. This natural blind spot can expand, okay. So this natural blind spot, it will expand, okay. This is called, this expanding of the natural blind spot, this is called bearing of the blind spot, okay. Now the last early visual field defects in glaucoma, it is called sedal scotoma, as it is in a sedal shape. So when a scotoma, when a visual field defect, it expands above this natural blind spot and below this natural blind spot, this is called sedal scotoma, okay. And sedal scotoma, okay, it is a sedal shape or sickle shape, okay. That's why it is called sedal scotoma. So these were the early visual field defects in glaucoma: the generalized depression, paracentral scotoma, Raynaud's nasal strip, bearing of the blind spot, and sedal scotoma. Now, if the glaucoma is still not managed, now we can have moderate visual field defects, okay. In the moderate visual field defects, the first one is that this sedal scotoma is in the early visual field defects, okay. Now we will have moderate visual field defects, okay. So in order to clear it, moderate visual field defects, okay. So in moderate, the first one is that this sedal scotoma in the early field defects, this will expand like this in arcuate shape, okay. It will expand like this in arcuate shape. It can expand from this sedal scotoma or can develop individually, okay. So it can develop like this. This is called arcuate scotoma, which is also called Bijram scotoma, okay. Bijram scotoma, okay. So this is the first one, moderate visual field defect, okay. Now this Bijram scotoma in the moderate visual field defects, it can extend all over this central visual field defect, okay. So this is the central visual field, as we know that, okay, as we have previously discussed in the perimetry, that it represents the central visual field, okay. So around this central field, when this Bijram scotoma form a ring shaped structure, so this scotoma is called, now this is called ring scotoma or double arcuate scotoma, okay. So it is in a ring form, okay. So it is called ring scotoma or double arcuate, okay. So this is the arcuate scotoma, okay. So it will become a double arcuate scotomas. So this is the second moderate visual field defect. Now there can be a peripheral depression. Peripheral depression is that as in the early fields, we have the Raynaud's nasal strip. This Raynaud's nasal strip can extend all over the 360 degree of the peripheral visual field, okay. So from this Raynaud's nasal strip, this visual field defect can extend all over the peripheral field, okay. And this peripheral field defect in this blind spot all over the peripheral field. This is called peripheral depression. Okay, so we have the peripheral depression. Okay, now we can have from this arcuate scotoma, okay, from this double arcuate scotoma or ring scotoma, there can be from this through this Raynaud's nasal strip or temporal, which through this it can also expand. This can also expand like the peripheral depression all over the peripheral visual field. Okay, all over the 360 degree of the peripheral visual field. Now this defect, the double arcuate scotoma through the temporal wedge, and this peripheral depression. Okay, this is called peripheral breakthrough. Okay, so we have peripheral breakthrough. Okay, now the double arcuate scotoma has expanded to the peripheral all over the 360 degree of the peripheral field. Now, okay, so these were the Bedroom scotoma, the ring scotoma, peripheral depression and peripheral breakthrough. These are the moderate visual field defects. Okay, now if still the glaucoma is not managed and if the glaucoma is severe, then we can have advanced visual field defects. Now the glaucoma has been such advanced, the glaucoma has been such advanced that it has produced advanced visual field defects. Okay, the advanced visual field defects includes only there can be the remaining of a central field of vision and only a temporal field of vision. Okay, all the ganglion has been dropped out, so we are only left with the central ganglions and a little bit of temporal ganglions. So we have now, there is only the remaining of two small visual tubular field of vision. These are the central field of vision and temporal field of vision. Now this advanced visual field defect can extend only to the central field of vision. All the retinal ganglion has been damaged, and now we have only a small central tubular field of vision. Okay, so we have only a central tubular field of vision and all the ganglion has been damaged. Okay, now this advanced visual field defect can be only there can be the remaining of temporal field. Okay, so we can have only the a small temporal field of vision. Okay, so the advanced visual field defects can be the central and temporal field of vision, only the central field of vision. Okay, only the central field of vision is small and only a small temporal field of vision. Okay, so these were the visual field defects in glaucoma, which can be early, okay, which can be early visual field defects, which can be moderate visual field defects, and which can be advanced visual field defects if the glaucoma is not managed properly and timely.